Signs and symptoms of tumor in the larynx. Lump in the neck, and unexplained weight loss and difficulty swallowing could be signs of a tumor. Some symptoms are common to most throat tumors. Others are very specific. The throat, like the mouth, participates in breathing, speaking, eating, and swallowing, and contains several types of cells and tissues in which different types of tumors can develop. Check out the signs and symptoms caused by tumors in this region. Pharynx. The pharynx is an important structure common to the digestive and respiratory systems, formed by three different regions: nasopharynx or rhinopharynx, oropharynx, hypopharynx. Most cases of pharyngeal cancer are carcinomas, that is, tumors that originate in the epithelial tissue that covers the organ. It is considered a cancer of silent development, which rarely shows symptoms and therefore tends to be diagnosed in more advanced stages. In the early stages, pharyngeal cancer may have little or no symptoms. In more advanced stages, it may present pain or difficulty swallowing, ear pain or recurrent ear infections in adults, sensation of nasal congestion or obstruction, which affects one side and, after some time, both sides, speech alteration or even hoarseness, appearance of nodules, lumps, on the neck, sensation that something is stuck in the throat, choking on food, shortness of breath, nasal discharge or bleeding, coughing up blood, unexplained weight loss. Risk factors. Know the factors that increase the likelihood of developing pharyngeal cancer. Gender. Most cases occur in men. Smoking is a risk factor for pharyngeal cancer, especially in the oropharynx and hypopharynx. Alcohol alone, the consumption of alcoholic beverages is already an important risk factor. Combined with smoking, the risk multiplies. This combination greatly increases the risk for several types of cancer. Food. Some studies indicate that populations that consume a lot of food preserved in salt are at greater risk of developing pharyngeal cancer, and that the consumption of fruits and vegetables can reduce the risk of developing the disease. Viral infections. Epstein-Barr virus (EBV) is associated with the risk of nasopharyngeal cancer. HPV is associated with oropharyngeal cancer. Diagnosis. The most commonly used method for examining the pharyngeal region is nasopharyngoscopy, which uses a flexible fiber optic tube inserted through the nose to look at the inner lining. Confirmation or not of the diagnosis is made by biopsy. Imaging tests may include CT, MRI, positron emission, tomography, PET-CT, and X-rays. Staging. Staging is a way of classifying the extent of the tumor and whether it has affected lymph nodes or other organs. For this, a combination of letters and numbers is used: T for tumor, N for nodes, or lymph nodes, and M for metastasis, in addition to numbers ranging from 0, no tumor, no affected nodes or no metastasis, to 4, the latter indicating greater involvement. Treatment. Depending on the location and stage, treatment may include surgery to remove the tumor and/or a combination of radiotherapy and chemotherapy. Pharyngectomy is the name of the surgery that removes part of the pharynx. Currently, robotic surgery is used in the oropharynx and, in the case of the hypopharynx, a laryngectomy may be necessary along with the pharyngectomy. Often, after removing the pharynx, surgery is required to reconstruct it and improve swallowing ability. As this cancer can invade the lymph nodes of the neck, since it is diagnosed at a more advanced stage, it is almost always necessary to surgically remove these nodes. Rehabilitation. The treatment of pharyngeal tumors can cause physical sequelae, aesthetic and functional, as well as psychological and social ones. The most frequent functional problems are those related to phonation, pharyngeal stenosis, some patients ingest only liquid and pasty foods, and shoulder pain. Therefore, integrated and multidisciplinary treatment is essential, together with doctors from different specialties, speech therapists, nutritionists, psychologists, nurses and social workers, in addition to family members. Thanks for following the Healthy Habits channel. Leave your like and subscribe to the channel. Until the next video.